Hello, everyone. Welcome to the Bay Area Association of Kidney Patients' latest webinar. Today, we are honored to have Pam Brown from Highcap Contra Costa as our speaker. As we wait for people to continue to come in, I'm going to speak a little bit about the AAKP and our history, and then we'll get started right away. The Bay Area Association of Kidney Patients has been around for 15 years now, and our mission is to support and educate kidney patients throughout the Bay Area. And with the advent of Zoom, now we reach people in other states too, which is great. We have educational presentations, we have newsletters we publish, and each month we have support groups. And right now our support groups are on Zoom, but we hope soon to be able to start meeting again in person. So at this point, I'm going to turn it over to Pam Brown from Contra Costa HICAP. She's a staff consultant there and has been with the program for 12 years. Please welcome Pam. Oh, and please, everybody's muted. And if you notice down at the bottom, there's a Q&A button. And use that to answer your questions, and we'll answer your questions at the end. So Pam, I'm going to turn it over to you.
Okay, well, thank you. Hi, everyone. I'm very honored to be here and speak to you today. And even though I'm with Contra Costa HICAP, which I'll be talking a little bit in a moment about what HICAP is and what we do, there's a HICAP or an affiliated in every county and throughout the country, because California, we're called HICAP. It's under the umbrella of state health insurance assistance programs known as SHIP. And they're SHIP programs, and some states, they have different names in every state and county in the country. So they're an excellent resource for impartial, unbiased information on everything related to Medicare. So with that, I'm going to share my screen and get to my slides. I just want to tell you that Medicare alone is extremely complicated. And for instance, our program has a 2-hour welcome to Medicare class for people that are just aging into Medicare or getting it due to disability about the ins and outs of Medicare and how it works and enrollment and coverage you can get with it. So this ESRD throws a whole another layer on top of that and a lot more complexity, because the normal rules for Medicare don't pertain to ESRD Medicare as far as who's eligible and when you're eligible and enrollment and if you can defer and what your options are. So it's a whole nother layer of complexity. So since we have limited time today, there's no way we can go in depth in every single detail, and it would be completely overwhelming to you. So this is going to be a pretty helpful, some general information about how Medicare works and the details of the nuances about how people with ESRD and that Medicare works. But the goal isn't for you to end this and know everything and be an expert and completely comprehend it, because it's impossible, especially on this topic. So we're going to talk about the resources where you can then follow up and get more information, which is your local HICAP or SHIP program and some other resources. Now I'm going to share my slides and we're going to get right into it. So let me get to my presentation. Okay, and let me get my screen so I'm not blocking, and start my slideshow. All right, so I've titled this Medicare and ESRD, What You Need to Know. And again, I'm with Contra Costa County HICAP's Health Insurance Counseling and Advocacy Program. And what is HICAP? And this pertains to the SHIP programs all over the country. Basically, we are an impartial source funded and sponsored by a combination of the federal government and local state governments under the Department of Aging. And our mission is to provide education, counseling and advocacy for everything related to Medicare. That means Medicare itself, but affiliated insurance coverages such as Medicare Advantage plans, prescription drug plans, Medigap Plans, or how your Medicare works with employer coverage and so forth. So we have one-on-one counseling at our program throughout the county, in person or on Zoom or on phone. And we actually sit down with you and look at all your facts and information and help you understand your options. We'll never sell or endorse anything or tell you what to do, but we provide you all the available information and help you understand it so you can make the best decision for yourself. We also do educational programs such as this or our Welcome to Medicare class. And if you have a problem with coverage denial with Medicare or your affiliated plan or a claim or a bill, we help advocate on your behalf, including legal assistance. And HICAPs are primarily volunteer organizations. The volunteers have to go through extensive training in California with then they get registered with the State Department of Aging and ongoing monthly in-service training and a lot more to it. So they're very knowledgeable and they have the support of their staffs, which are people like me. And as I said, funded by a combination of state and federal government and counties in some situations, and not affiliated with anyone. So not any high pressure or pushing you in a certain direction. And best, the services are absolutely free to you. So here's our agenda for today. We're first going to talk about ESRD Medicare eligibility and enrollment rules, because I said they're different than they are for other types of Medicare. Then the costs and covered services under that, of course, touching on those things for dialysis, for kidney transplants, and immunosuppressant drugs after a transplant. And then we'll get into how Medicare, ESRD Medicare works, their insurance you may have. If it's employer-based insurance, it's very critical to know about the 30-month coordination period. And we'll talk about some things to consider and strategies in that case for when you should enroll in Medicare. And then if you just have Medicare and not any employer-based insurance, options for supplementing your Medicare through Medicare Advantage and Medigap Plans or through the Affordable Care Act coverage. And then finally, there are some programs for people with limited income and assets can help with some of the Medicare costs. So we'll mention those. And then lastly, as I said, where to get more help. So first of all, who's eligible for Medicare? So in general, for the population in general, there's 3 different categories of people who can get Medicare, and it's always individual health insurance. It's not joint with your spouse or family. Each person is eligible and applies on their own. The biggest category, of course, is people 65 years old or older, and they have to either be a citizen or a permanent legal resident in the US, in which case they generally have to be here for the last 5 consecutive years. And it's important to note this is called aging into Medicare, that you do not have to be retired or eligible yet for your full Social Security benefits, which can, you can take Social Security if you're getting retirement benefits, not disability benefits, either as late as age 62 or as late as age 70, but that's completely independent of your eligibility for Medicare at 65. And then the second biggest category is people under 65 if they're disabled, and that means they have to have Social Security disability insurance, SSDI, for 20 months or more. And then if so, in the 25th month, they start their Medicare. And then lastly, there's special rules for people with ESRD or ALS, And in this case, you can be younger and you don't have to be on SSDI and you don't have to wait 24 months. So this is what we're going to focus on now. But this note is important that for ESRD Medicare, the eligibility, the enrollment, and the coordination of benefits with other coverage that you may have works differently than it does for these other categories. So that's why it's extremely important to talk to someone knowledgeable at your local HICAP or wherever first. So Medicare in general, and this works the same way no matter how you have it, has 4 basic parts. Part A, which is inpatient hospitalization and some related things. Part B, which is everything out, doctors and ambulance and emergency room and outpatient surgery and procedures and labs and so forth. Part C is an alternate way to get your Medicare services, private plans called Medicare Advantage. Kaiser's a big one that you're probably familiar with, and other managed care plans. And then Part D is the outpatient prescription drug benefit for most drugs that you would go pick up yourself at the pharmacy and take. But some drugs are under Part B or Part A, so there's that. So let's now get into the details regarding ESRD and the eligibility and enrollment. So to be eligible for what's called ESRD Medicare, as opposed to disability Medicare or aging into Medicare, you have to be under 65, have a diagnosis of ESRD, in other words, permanent kidney failure that requires dialysis or a transplant, have enough work history, and this I can't address. You have to talk to Social Security. If you're aging into Medicare, you need, or your spouse needs, at least 40 quarters credits of contributing to Social Security. If you're getting SSDI Medicare, there's a sliding scale based on your age. For ESRD, I don't know the details. It's something you have to check with Social Security, whether you're eligible or enough. But you can, doesn't have to be your own work history. It can be a spouse or other family member that you're dependent on. And so you have to talk to Social Security. And children can be eligible in Medicare if the parent has enough work history. And this, the parent has to have at least 6 credits of work history within the last 3 years with Social Security. And they have to be eligible for or receiving either Social Security or railroad retirement benefits themselves. And to be considered a child and be eligible, you're either unmarried and under age 21, or unmarried between age 22 and 25 and dependent or receiving support from your parents, or an adult dependent child of any age if they were determined disabled before 22. Okay, so how do you enroll? First of all, you must actively enroll in ESRD Medicare through Social Security. And often the doctor or the dialysis center, there's always verification paperwork they have to send establishing that you're eligible and diagnosed with ESRD. But the way it often works is they send this paperwork first to Social Security before you even talk to Social Security. And you might think if they did that, you're automatically enrolled and it's good to go. And that's not true. You will always need to sign the application, which is called Form CMS 43, or a family member or other authorized individual can enroll on your behalf. So if Social Security gets the paperwork first, they may be calling you or reaching out to you to say, do you really want to enroll? And if so, you need to sign. Otherwise, you can apply first and then they will contact or ask you the provider to submit the paperwork. But in any case, you or someone on your behalf to actually sign and confirm that you want to enroll. It won't just happen automatically. And this is really important. So when does your ESRD Medicare eligibility start. And the eligibility may not be the same as your enrollment date, but certain things, clock starts ticking on the date of your eligibility, which we'll see later. So you need to pay attention to this. So it depends on your type of treatment for your ESRD. If you're getting either in or outpatient dialysis at a facility, then you're eligible to enroll in Medicare starting the first day of the 4th month of your dialysis. So there's essentially a 3-month waiting period. And starting the month you start getting dialysis at a facility, and even if you decide not to enroll in Medicare in the 4th month and you want to delay it till later, you've met your 3-month waiting period. So you won't have to do that again. If you're getting home dialysis or self-dialysis, then it's actually, you're eligible in the first day of the 1st month of your training program. And to be eligible, the doctor has to certify that they expect that you can complete the training program and continue on dialysis yourself once that ends. And then finally, if you're getting a kidney transplant, you're eligible starting the month you're admitted to a Medicare hospital for the transplant or for any services you need prior to the transplant. And we'll see in a bit, you actually have up to a year after the transplant, and it can be retroactive. But in any case, have to get the transplant within 2 months following the start of your coverage if you're going right into the hospital and starting your eligibility. So ESRD Medicare can end. It's not the Medicare you're going to have for the rest of your life after you're 65 and onward. There's 2 circumstances when it can end. Either you no longer need dialysis, and then it will end 12 months after your last treatment, or if you had a successful kidney transplant and it's still working 36 months afterwards without rejection, then after 36 months, your ESRD Medicare will end. However, it will continue if you again start getting dialysis within 12 months after stopping it, or need another transplant within 12 months of your coverage ending. And if you do qualify again for ESRD Medicare, you will not have a waiting period for your coverage to start. It'll start immediately on the very first of the next month, or the month you start treatment again. And if while you're on ESRD Medicare, you also become eligible for Medicare because you turned 65 or you had 24 months of SSDI payments, then even if you stop dialysis or have a successful transplant, your Medicare due to these other reasons will continue. All right, so when to enroll in ESRD Medicare. We talked about when you're eligible, depending on your type of treatment or transplant, but when should you enroll? Well, you can enroll in parts A and B. That's your basic 2 main parts of Medicare. Anytime if you're eligible, but there's some key things to consider. First of all, it's very imperative that unlike people aging into Medicare who might be working and want Part A and defer Part B, that absolutely will not work for ESRD Medicare. You need to get both Parts A and B together at the same time. Whenever you get them, it has to be at the same time. And as I mentioned earlier, Part A can be retroactive up to months. Obviously, it can't start before you were first eligible under the eligibility criteria, but it can go as early as 12 months before if you were deemed eligible then. And since Part B enrollment is connected to Part A enrollment, Part B could also be retroactive, but it doesn't have to be. If your pay is retroactive more than 6 months, you have the option to have your Part B also be retroactive, or to start it the month they apply for it instead. So some strategies to think about as to when you should enroll. First, do you already have Medicare for another reason, age or disability? If you do, you don't even have to care about ESRD Medicare, but sometimes it's beneficial to also enroll in that form of Medicare. The reasons are because ESRD Medicare can be proactive up to a year. If you need an earlier start date than you would get due to disability or age, that's a reason. Or if you have late enrollment penalties because you didn't enroll on time due to age or disability, if you enroll in ESRD Medicare now when you're eligible, it'll wipe out your penalties. So you essentially get a second initial enrollment period. Or if you're getting SSDI and your 24 months of that hasn't finished yet, so you have that waiting period for Medicare for that reason, and you become eligible for ESRD Medicare before the end of that 24 months, then you would be able to start right away. So that's if you already have a different type of Medicare, and should you consider also taking ESRD Medicare. If it's the other way around, if the only Medicare you have first is ESRD Medicare, and then you either turn 65 or finish your 24 months on SDI, you absolutely for sure should also enroll in that type of Medicare too. Okay, so now we're going to touch very briefly on the general way it works with Medicare costs and coverage for ESRD. And these costs are the same for everyone with any kind of Medicare. For Part A, that was the inpatient hospitalization. If normally for someone who ages into Medicare, as I said, there's no premium if you worked and contributed to Social Security or your spouse did for at least 40 quarters. Again, for disability and ESRD, it's a different sliding scale, whether you're eligible or not. And if you are, then it's automatically free. For people aging into it who didn't work enough quarters, they can buy it. Besides the premium, if any, though, there's cost sharing. There's a deductible for your first day in the hospital, which this year is $1,600, and it's not an annual calendar year thing. For Part A, it's what's called a benefit period, which basically means you're still in the same benefit period, and you can go in and out of the hospital as an inpatient or related skilled nursing as many times as necessary, and still be in that benefit period and not have to pay the deductible again, unless you're home for 60 straight days in a row. Once you're home for more than 60 days, you start a new benefit period. And then if you go back to the hospital, you pay that again. Part B, which is all the outpatient stuff, everyone pays a premium, has nothing to do with whether you worked X number of quarters or not. This year, that base premium is $164.90, so roughly $165 a month. And there is a surcharge for higher income, so there's about 6 different brackets. And if you're making more than $500,000 a year as a single person, you would be paying about 3 times this amount. And they look at your income from 2 years ago. But as a lot of people might have retired since then, or lost their job, or got divorced or whatever, you can adjust it if it's a life-changing event, and then they'll be looking at your current income. And then besides the premium, the other cost sharing, in this case, it's a calendar year deductible. You pay the first $226 of covered Part B services, and Part B kicks in and pays after that, in which case for most things, they pay 80% of the Medicare approved amount and you pay 20%. And labs and home health care, you actually pay 0. They pay 100%. The thing though with Medicare Parts A and B, there's no yearly out-of-pocket maximum on your costs. So for expensive things like chemotherapy and dialysis, you would just be paying 20% of whatever with no limit. So that's why you need other kind of coverage to go with your Medicare to help limit your risk. And we'll see at the end, some programs can help, depending on your income and assets, pay the Part B premium and some of the other things. So how about the coverage itself? Well, for ESRD treatment, Medicare covers kidney transplant. They cover immunosuppressant drugs after the transplant, although the type of coverage, whether it's Medicare Part B or D, depends whether you had Medicare when you had the transplant, and we'll talk about that in a little bit. They pay for inpatient dialysis, outpatient dialysis from an approved facility, home dialysis training and equipment from a facility, training for you and any caregivers, all the supplies, medications necessary for your treatment. And of course, besides ESRD specific things, Medicare also would cover, even ESRD Medicare would also cover any of the normal things you have for other illnesses and ailments and everything unrelated to ESRD. So it's full comprehensive health insurance. So let's talk a little more about this coverage. So for transplants, Part A covers inpatient transplant and if necessary, inpatient dialysis. And you would pay that hospital deductible per benefit period, which is $1,600 this year. And then you pay for the next 60 days. After 60 days, if you're still an inpatient in the hospital, you do have several $100 a day copay, and your local Highcap can give you more information about all of that. And we have sites, wonderful. Anyone, anywhere in the country can look at it and get a lot of this information. Part B, even if you're an inpatient in the hospital, always for any kind of Medicare, the doctors that treat you there, like surgeons and radiologists and anesthesiologists and everything, they're contracted with the hospital, and that's always Part B, and that's where you would pay the 20%. If your doctor doesn't accept what's called Medicare assignment, they can charge you an extra 15%, so you would be paying more like 35%. And some other things related to transplants. If your non-functioning kidney needs to be removed after the transplant, you need to talk to your provider about costs and coverage, because I don't know the details of that, and whether Medicare covers it or not. So that's something to look into. And Medicare does not cover the initial blood and tissue tests needed to identify a donor. So you're on your own for that. And once you have identified a donor, however, they do cover the costs related to the hospital stay and any follow-up care immediately following the surgery. Okay, how about outpatient dialysis? Again, this is Part B, and it has to be a Medicare approved facility, of course, and they pay the doctor's services. And again, you pay 20% or 35% if they don't take assignment. And in this case, what they're covering are all the services for dialysis, equipment, supplies, most lab tests, which again is usually at 100%, and most dialysis medications. And again, these would be under Part B, not under your separate drug plan. And all these services are typically bundled together, and then you have a separate charge for the doctor's fees. If you're doing home dialysis, again, Part B, Medicare approved, facility to provide your supplies and training. And again, you pay 20% or 35%. And in this case, coverage covers all the services, equipment, supplies, again, most lab tests, meds billed together. And then supplies, it's important to note, are usually provided by a durable medical equipment supplier, a DME supplier, and it has to be one approved and contracted with Medicare, which is changes based on your region that you're in. So you may not get any coverage at all if you get those supplies through a non-Medicare approved supplier for your region. So it's very important to ensure that that's the case. And it's also important to note, Medicare is very strict about ambulance coverage, and they have to have two main conditions are the ambulance was really necessary and any other means of transport was contraindicated, meaning that it was absolutely impossible for medical reasons for you to take a cabulance or have your spouse drive you or something. So we deal with a lot of denials of ambulance cases. So it's very important that you to not think you can just rely on the ambulance to take you to and from the dialysis center unless those conditions are met. All right, so now we're going to get into how Medicare works with any kind of insurance you might have, whether it's other insurance through related to Medicare or from other entities. This is where it gets, the rules are different than for people with other types of Medicare, and it gets complicated. So some things to consider before you even decide to enroll in ESRD Medicare, besides the things we mentioned earlier, are if you have employer-based coverage, how that even coordinates ESRD Medicare, and that can be very, very tricky. And how Medicare covers immunosuppressant drugs after a transplant. Because as I said, whether it's covered under Part B or Part D depends. So we'll be looking at all this in more detail right now. Okay, so employer coverage, unlike for people aging into Medicare, for people with ESRD Medicare, the definition of employer coverage means any combination of coverage from your or your spouse's current job, retiree insurance, Cobra, or union coverage. And this is different. If you're aging into Medicare, they only consider employer insurance active work, not retiree or Cobra, and the rules are different. But with ESRD Medicare, all of this is considered employer coverage. And as I said, the regular rules don't apply if you have ESRD. So we'll talk about how it does work right now. But in any case, for ESRD Medicare, the coordination of benefits rules are the same for all these kind of coverages. And the key here is something called the 30-month coordination period. And this is really tricky. So how it works, during the first 30 months, once you become eligible for ESRD Medicare, again, we saw on an earlier slide that timing depends if you're inpatient dialysis, outpatient, or a transplant. But once you're considered eligible, the 30-month clock starts ticking. And whether you want it to happen or not, in that 30 months, your employer insurance, which again can include Cobra and retiree insurance, always by law pays primary. So they're the first payer, and any employer insurance you would have would pay secondary to that, the remaining parts that Medicare doesn't pay, your cost sharing. But depending on your coverage, they may or may not even cover some of that cost sharing deductible and so forth. And if you have employer coverage during this first 30 months, you're not required to take ESRD Medicare. You can just continue like normal on your current employer coverage, and there may or may not be any benefit for you to take ESRD Medicare. But the key thing is, at the end of that 30-month clock, then you have no say, your employer has no say. By law, your Medicare becomes the primary payer. And if you're not already actively enrolled in Medicare Parts A and B by then, you will have to wait till the next general enrollment period, which is usually just the start of the year, which could be a whole year later, and have no primary coverage until then. And even if you didn't enroll in Medicare, again, the clock started ticking when you were first eligible. And if you need to get it before the end of that 30 months, or you're going to have a big problem. In fact, I first started delving into the ins and outs of ESRD Medicare about 6 or 7 years ago. We had a client call us. He had been getting dialysis for 2.5 years or so. All of a sudden, in month 29, he was told by the dialysis center, oh, your employer coverage isn't going to cover you starting next month. You need Medicare A and D, and that's going to cover you. He had enrolled in Part A early on because it was free, and he said, why not? But he hadn't enrolled in Part B because he didn't want to pay the premium, and he thought he didn't need it because for people aging into Medicare, that's true. You can wait. So all of a sudden he was in a panic, and he called us what to do. Social Security told him, oh, you have to wait till next year for Part B to the general enrollment period, since you have Part A. With ESRD, you had to get them both at once, too late. But I looked into it and discovered what he had to do. He had to disenroll from Part A. If Part A had paid any benefits, like he'd been in the hospital, or if he'd been getting SSDI, he would have to pay that all back to Medicare, and then pretend he had a fresh slate and get both A and B again at the same time that month before the end of 30 months. Luckily, he hadn't incurred any costs under Part A, and he hadn't been getting any benefits from Social Security, so he had nothing to pay back, but he did have to disenroll and then re-enroll in A and B together, and he got in just under the wire. Otherwise, he would have been responsible for tens of thousands of dollars of dialysis costs for the rest of the year. And I think this was April when he contacted me. So it's very, very, very important. But you can defer A and B until right before the 30-month period ends if you want. And we'll talk in a minute about the pros and cons of whether you should take it right away or defer it and things you need to consider. And if you don't have Medicare by the end of 30 months, the employer may not, besides only paying secondary, like the 20% that Medicare doesn't pay, they might not cover you at all. They have that right. So, so more about this, since it's so important. If, as I said, you did enroll in ESRD Medicare and you're still in that first 30 months, then Medicare is secondary and your employer insurance pays first. And whether it's retiree or Cobra or active employer, same thing, it does not matter, which is different than how it is for other Medicare. And again, even if you didn't enroll, that clock started ticking. And then after the 30 months, your Medicare will pay first. And you may not even know that it all switches over. It may be, transparent to you. And again, it'll switch over even if you haven't enrolled yet. And then you'll know, because then you'll get big bills you're responsible for. So what to think about? If you have employer coverage and now you're eligible for ESRD Medicare, it may still be a good idea to enroll in ESRD Medicare when you're first eligible at the start of that 30-month period, because Medicare may help as secondary payer with some of your employer if you have high deductible plan or have 30% coinsurance or whatever. They may help. Also, they have limits, the Medicare approved amount on what providers can charge. And even if they're only the secondary payer, those limits are in place. So that could help reduce some of your costs if it's on a percentage basis. And again, if you're going to have a transplant and you want lifelong coverage of your immunosuppressants under Part B, not Part D, then you need Medicare at the time of your transplant. So it's important to weigh all of this, to ask your employer how your costs under their plan will compare with and without Medicare as secondary, and see if it's worth the premiums. Other important considerations, if you're thinking of delaying, is, well, as I said, I can't emphasize enough, delay both parts A and B and don't take A without B. And then you have any time within that 30 months, 6 months into it, 20 months into it, month 29, you can enroll in both. Because we already talked about what happens if you only enroll in part A and not B, and then the 30 months ends. So you have to make sure you have adequate coverage though at all times. So to prevent a coverage gap, again, apply for both A and B at least several months before. Month 29 is cutting it close. Social Security services have been impacted because of COVID and they're not as prompt. You don't want to wait till month 29. You would do it 2 or 3 months at least before your 30 month ends. And remember to be careful how you count the 30 months, because it was based on slide 10, based on your treatment. The very first month you're considered eligible. And we already talked about these other things. And if you had a transplant, in that case, based on back to slide 10, you can enroll the first month you're in the hospital for your transplant, or within 12 months after, retroactive. So you have a little more time, but be sure not to wait past that 12 months if you want that Part B coverage of your drugs. So here's an example. Francesca received her ESRD diagnosis in May 2013, started outpatient dialysis that month, so May 2013. That's when the clock starts ticking. She has insurance based on her spouse's work, so she decided to wait and not get Medicare because she didn't need it in that first 30 months. The social worker at the dialysis center said she should get it before the end of 30 months. That's correct. So the question is, when does the 30-month coordination period begin? Actually, I already answered it. I shouldn't have told you. It begins May of 2013. So counting 30 months it begins August of 2013. Because she's getting outpatient dialysis, back on slide 10, that said there's a 3-month waiting period and your eligibility is month 4. So month 4 would be May, June, July, August 1, her eligibility begins. So the 30-month coordination starts on August 1, which means before February 1 of 2016, she needed to get parts A and B of Medicare. And if she was going to get a kidney transplant sometime before that date, she either had before the transplant or within 12 months after it to protect her, and this should say 30 months here, not 20, to protect her Part B coverage. All right, so moving on, Cobra and ESRD Medicare. I'm sure you all know, but if you don't, Cobra stands for Consolidated Omnibus Reconciliation Act, which was a law Congress passed in the mid-1980s, giving individuals the right to purchase continued health coverage from their employer for a limited amount of time after that coverage ends due to termination of employment, divorce, death of a spouse, and some other circumstances. And for ESRD Medicare only, Cobra pays first, just like active employer insurance does during that first 30 months. But there's some important things to know, and this is true for anyone with any kind of Medicare. If you have Cobra first, and then you become eligible and enroll in ESRD Medicare, under law, the employer can end your Cobra. And you might have it for 36 months, depending on, because it can be 18 to 36 months, depending on the triggering event, but they have the right to end it early if you take Medicare. So before you take ESRD Medicare within that 30 months, you definitely need to take it before the end of 30 months. But before you decide to take it earlier, you need to talk to your employer and find out, are they going to then end your Cobra or not? Do you want them to end it or not? If it's the other way around and you first have ESRD Medicare, then say you can't work anymore and you're eligible for Cobra, in this case, you can have both. And your Cobra is still in that first 30 months. If you're still within that period, it pays first, like we said, and continues to the end of 30 months. But what if your Cobra is only good for 18 months and that runs out before the 30 months? Then your ESRD Medicare would become primary and you would need to get other coverage to supplement it. So this is all, I'm sure your heads are spinning and this is overwhelming because there's so many things to consider and factor and count and when things are first and second, which is why this is just giving you an overview of things you need to be aware of and know, so you at least know if you're going to be in the situation that you need to do more research and talk to your local Highcap program and get help figuring it out. So now let's say you have no more employer-based coverage of any sort, no Cobra, no retiree, you and your family members aren't actively working. So what can you get to go along with your Medicare Parts A and B to help cover some of those gaps in cost sharing? So this is true, this chart, for anyone with any kind of Medicare. There's two ways you get Medicare coverage. On the left is what's called original Medicare, and this is a fee-for-service model, which most insurance for 40 years now hasn't followed, except for Medicare. And what that means, and this applies to Parts A and B of original Medicare, that means that Medicare, officially the Centers for Medicare and Medicaid Services, CMS, is the insurer. They're the administrator and they're the insurer. So you go to the doctor, they perform a service, they charge a fee. They bill the insurer, in this case CMS, who pays their part, let's just say 80%, and then they bill you for your part, the 20% and the deductibles. And there's no network, there's no authorization from a plan. You go anywhere in the country that takes Medicare and you're good. But if you don't want to pay those deductibles and that 20%, most people, but we'll hear more about this in a minute when it comes to ESRD, have the ability to buy a private insurance plan called a Medicare supplement, or for short, a Medigap. And for Medicare approved services under Parts A and B, depending on what Medigap plan you have, it pays for that 20% and those deductibles and so forth. And CAPS puts a risk on and covers those dialysis costs, even 20% of them. And then for most of your outpatient drugs, you buy a separate drug plan from a private insurer. And that way you get more complete coverage. And these two parts here are optional. Or you decide instead of this model, you're going to assign your Medicare benefits to a Medicare Advantage plan like Kaiser. These are managed care plans. This is what most of us are familiar with, PPOs, HMOs, so forth, where there's a network. And you have to use a provider within the network or pay more if you go outside of the network, if you're even allowed to, and so forth. And they have their own copays. So with Medicare, this is also known as Part C, and it bundles the services of Parts A and B, and most plans also cover the Part D drug part. And you cannot buy a Medigap and have a Medicare Advantage. You have to be on one path or the other, and you have very limited times when you can switch. You're usually locked in for a year unless you move out of the county or something. And your rights to then get a Medigap can be limited based on pre-existing conditions. So the timing of all of this is critical, and anyone starting Medicare really has to weigh and understand their options here. And if you have the Medicare Advantage plan, besides the rules about the network and providers that participate. They all have their own premiums, own copays, and out-of-pocket max, own drugs on their formulary. Some offer additional things like dental and vision that original Medicare doesn't cover. So these are all things that HICAPs help you understand. But the important caveat, if you're in California, there are some states where this isn't true, but federally and California, and you have ESRD Medicare, or you just have ESRD and you're under age 65, you are not allowed by law to buy a Medigap plan. So if you're under 65 with ESRD and you don't want to be on the hook with no upper limit for 20% of dialysis, this is not a good option for you. And you need to, you're only, and you don't have employer insurance, then Medicare Advantage is what you need to be looking at. But once you turn 65, even though you may have ESRD, then you're good. Then you are allowed to get a Medigap. But since they can look at pre-existing conditions, there's only certain periods when you're first eligible at age 65 to get one without doing health screening. So again, that's something you have to talk to your HICAP and make sure you understand. So in fact, more on that. So normally Medigaps supplement original Medicare, so they cover that 20% Part B coinsurance and cap your exposure. They're sold by private insurance companies. As I said, there's 10 levels of plans with letters: Medigap Plan F, Medigap Plan G, Plan N, Plan A, and the premiums and whether they cover all the deductibles and so forth depends on what level of plan it is. But a Medigap Plan G, let's say, whether it's in California or Alaska or Maine, doesn't matter. They're all highly standardized and they all cover the exact same services. And it doesn't matter what companies it's with or anything. The only thing that matters is the premiums can vary. And as I said, in California and many other states, if you're under 65 with ESRD, you can't get a Medigap. But the minute you turn 65, you have the same rights as anyone else within a limited time to be guaranteed and not to deny you because of your health. So that's why you have to be very paying attention to that. Just real briefly, I think I've said most of this, but Advantage plans, again, you assign all your benefits to the plan. If it's an HMO, you usually cannot go outside the network, and the network, the plans vary by county. They're very specific by county, and you have to use, the providers are usually only within a county or 15 miles from their zip code or all sorts of things like that. Kaiser, you have to join the Kaiser that's affiliated with your county because they're all a little different as far as their premiums. But of course, you can go to any Kaiser facility anywhere in the state. And they cannot restrict anyone ever based on health. So if you're under 65 with the ESRD, you can join one and pay the same premium as anyone else. And certain counties actually have special needs Advantage plans targeted for people with ESRD. Contra Costa does not, so I can't speak to them, but your county might. And again, each county, the plans vary. We have had only HMOs in Contra Costa for 10 years, except this year for the first time, we have one PPO. Other counties have even other types of Advantage plans. And again, they all have their own rules, their own copays, their own premiums, and so forth. So what about Part D and ESRD? So Part D is D for drug coverage for the drugs that aren't covered by Parts A and B. Most outpatient drugs you would get for cholesterol or antibiotics or whatever. And Part D can come two ways, either as a standalone drug plan, if you're on that path of original Medicare with or without a Medigap, and then a drug plan, or bundled into the other path of an Advantage plan. And except for transplant medication and most immunosuppressants. It covers any other medication you may need. And if you have employer-based insurance or Cobra or any of that that includes drug coverage, you should talk to your employer first and find out how Part D would work with their coverage, because often if you enroll in a standalone Part D plan, it'll automatically kick you out of your employer coverage, and you may not be able to get that back. So you need to understand this first. And unlike Part B, if you have ESRD Medicare, people with any kind of Medicare can defer getting a drug plan if they have what's called creditable coverage through their employer coverage. And creditable means it's at least as good as the Medicare standard Part D plan. And every coverage is required by law to say somewhere in writing whether it is creditable or not for Part D. And if it is, you just need to save the proof of that for every year that you have that other coverage, because when you finally do go to enroll in Part D, they may make you wait or charge a penalty if you don't have proof that you had creditable coverage. And as I said earlier, if you did not have Part B at the time of your transplant, therefore you'll, for the rest of your life, Part B will never cover your immunosuppressants, but in that case, Part D will. And all Part D plans have their own formulary. That's their own list of covered drugs. But by law, all of them must include all the immunosuppressants. They can't just pick and choose. And Medicare normally does not cover post-dialysis vitamins. And although some enhanced Part D plans can be termed basic or enhanced, some enhanced plans might. Of course, enhanced plans usually have a higher premium. And just to give you an idea, in California, it's the same regardless of your county. This year, the Part D plans are as cheap as $4.50 a month and as expensive as $172 a month. Huge range depending on what drugs they cover. So, and your Highcap, there's tools that can help you figure out the best plan for you. All right, so how about that immunosuppressant coverage that we keep talking about? So, as I said, it's very specific conditions whether Medicare will pay, Part B will pay for your immunosuppressants. So you had to have at least Part A at the time of your transplant, and that counts the time when you can have it be retroactive. And you have to still continue to qualify for Part B, either under ESRD Medicare or having aged into it or whatever. And if those two conditions are met, then the rest of your life, even if your transplant's successful and you never again are deemed ESRD, Part B will pay for those immunosuppressants. But if you didn't have at least Part A at the time of the transplant, even if 20 years later you finally turn 65 and age into Medicare, Part B will never pay for those particular drugs. And as we said, you should enroll in Parts A and B at the same time, either before your transplant or no longer than 12 months afterwards, if you want to assure this lifelong Part B coverage for those drugs. And what about ending that coverage? Well, as we saw, if you only had ESRD Medicare and no other type of Medicare, 36 months after your successful transplant, your Medicare A and B will stop. And you have to find another way to get coverage for those immunosuppressants. So if you also have, in addition to ESRD Medicare, you become eligible for age or disability related, then even if your ESRD Medicare ends, you have your other Medicare and Part B will continue covering those drugs. And typically, it's less expensive to have those drugs covered under Part B than Part D, because Part D had something called the donut hole and high deductibles and so forth. Although under the recent law in Congress this past year, there's been some big improvements to Part D, and down the road in the next few years, costs will be even further restricted. So it may change things, and it might not be that much worse in the future if you have to have them under Part D. But until now, it typically is more expensive having them covered that way. So another new thing under the law, the Inflation Reduction Act that Congress passed last August, I believe, is there is a new special Part B called Part B ID for immunosuppressant drugs now that Congress created. And so the way this works, and this was just effective this year, is it's the Part B ID only covers the immunosuppressant drugs if you don't have any other form of insurance. If you're not eligible for any other type of Medicare or employer coverage or Affordable Care Act or anything else, then you can get this Part B ID. However, it does not cover doctors or medical services or any other, blood pressure medicine or anything else. It only strictly covers the immunosuppressants. And for this limited special Part B, the monthly premium this year is $97 a month. You still have the standard $226 calendar year deductible that you have to pay first, and then you still have to pay 20% after that of the drugs. And again, there's no cap on that. There's no special enrollment period. You can enroll anytime you meet the conditions, and your coverage usually starts the month after your ESRD Medicare ended. And there's never any late enrollment period for getting this or penalty. And if you are eligible for any of the Medicare savings programs to help, like with your Part B premium or deductible, then that would apply to this as well. All right. So finally, we're getting closer to the end of our slides here. And we're going to touch on what about the Affordable Care Act and ESRD. So as I'm sure you know, Affordable Care Act is also known as Obamacare or Marketplace coverage in California. Covered California is the provider of it. And the terminology is a qualified health plan. QHP is what it allows you to purchase if you have no other type of insurance available to you. And under the Affordable Care Act, QHPs can either be individual, or if it's a small employer with say 5 or 10 employees, and they offer insurance for their employees, that's called SHOP plan. And in that case, the SHOP plans are treated just like any other employer insurance you have from Chevron or whatever, as far as the rules with ESRD and the 30-month coordination and all the stuff we talked about. So it's the exact same thing. So we're just going to touch on individual coverage, not related to any kind of job, and under the Affordable Care Act if you have ESRD Medicare. So generally, this is true for anyone. If you have any part of Medicare first, you're barred by law from purchasing a QHP under the ACA. But if you're under 65, you're allowed to disenroll from Medicare, repay Medicare, anything they've spent on you, and get a QHP instead, including any subsidies for your plan, your Covered California plan. And if you have ESRD and you have a QHP first, you're allowed to keep the plan even after you've taken ESRD Medicare. Normally, if you have a Covered California plan, not with ESRD, and you turn 65, you have to quit that plan and enroll in Medicare. But if you're under 65 with ESRD, you can actually keep your plan and take Medicare or not, and in any case, still qualify for the subsidies. And we'll see in the next slide about whether this makes sense to do this or not. But the key thing is making sure your plan will pay for your ESRD costs if you don't enroll in Medicare. There's no regulation that says they have to. It's up to the plan. So these are the things to consider. Your plan may pay little or nothing if you haven't enrolled in Medicare. So if you decide to forego taking ESRD Medicare and you're under 65 and you want to keep, say, your covered California plan with really good subsidies, get written confirmation from your plan that it will still provide primary coverage without you taking ESRD Medicare. And there's no set coordination of benefits rules for how QHP, these plans work with Medicare if you do have both. So they can do what they want. So it's really important to research this and find out what their rules are and whether you can forego Medicare or not, and who's going to pay first and second, and all of that. And remember, if you don't have Part B, and that means Part A too, at the time you had a transplant and you just relied on your QHP, then you're not going to have Part B coverage for those drugs the rest of your life. And in any case, ESRD, once you turn 65 or become eligible for regular SSDI Medicare, you should definitely enroll in it, because with either of those two types of Medicare, as soon as you're eligible, whether you take it or not, your eligibility for subsidies with your ACA plan ends. So, and ACA plans are, as I'm sure you know, outrageously expensive without subsidies. So you're much better off taking the other types of Medicare in that case. So finally, Medicare assistance programs. In California, Medicaid is called Medi-Cal. And for people that also have Medicare with the Part B premium of $165 a month, to be eligible for Medicare, if you're single, your income is $1,862 a month or less, $2,618 a month if you're married, because Medi-Cal lets you deduct health insurance premiums to determine if you're eligible. So these figures assume you also have Medicare and you get to deduct the $165 Part B premium, and that allows you to be eligible. If you don't have Medicare, then the figures to qualify for Medicaid are $165 lower than this income. Assets in California, which is much more generous as of last year than other states for Medi-Cal, $130,000 if you're single, not counting your home and car and a few other things. $195,000 if you're married. In 2024, next year, there won't even be any asset limit at all. If you currently have Medi-Cal and now you're eligible for Medicare, you'll transition to a different type of Medi-Cal than you had before. If you had the expanded Medi-Cal under the Affordable Care Act, once you're eligible for Medicare, you have to take Medicare, but the state, if you're still eligible for Medi-Cal under these rules, the state will pay your Part B premium. They'll assign you to something called extra help for your Part D, where you can get a plan with no premium or a discount on the premium, and much lower copays for all your drugs, like $1 for generic, $4 for brand. And you have additional ways to get your medical coverage. And then for if you're not, or you don't want Medi-Cal, these are less important in California now, because if you have Medicare too, you can actually have a higher income. But otherwise, same asset limits. And then there's these 3 Medicare savings programs with different income limits. The first 2 only pay the Part B premium, the $165 a month, and get you extra help for your Part D. The third one with the lowest income, if you didn't have enough credits to have free Part A, they would buy it for you, which is about $500 a month worth, as well as pay your Part B premium. And federal law you can't be charged any deductibles or copays or coinsurance for any Medicare services, and it gets you extra help with your prescriptions. And for all of these programs, some of your income, and same with Medicaid, if you're working, only half of your work income counts towards those income limits. And IRAs and things, there's some rules about that income. So again, your Highcap or SHIP program can help determine if you're eligible for anything and help you apply. And then lastly, higher income level, but lower asset is just to get extra help with your Part D costs and not any of your medical expenses. So that's another thing that we can help you with. So just to recap, what we've covered today is the eligibility and enrollment rules for ESRD Medicare and how that differs from other types of Medicare, the costs and services covered under ESRD Medicare for your related treatments, how it works with other insurance, with employer insurance and that very important 30-month coordination period, some things to consider about when to take it within that 30 months. If you don't have any other employer insurance, what your public Medicare options may be and how that works. And then if you have the option of Affordable Care Act plan and have ESRD, the details about that. And then finally, some assistance on the costs of Medicare if you're eligible. And our Highcap, Contra Costa, we have a wonderful website. Not just bragging, but it's probably the most comprehensive of any Highcap in the state. So even if you don't live in our county, you can get all sorts of information on the details of the different plans available, all the premiums, the surcharge for higher incomes. In California, the Medigap Plans and the Part D drug plans are the same for the whole state. So we have charts with all of that. If you have an Advantage plan, we only have the ones in our county, not other counties. So you'd have to contact your local Highcap. Here's how to call us if you are within our county, or how to email us. And again, all Highcaps and SHIPs throughout the country offer free, private, and partial service. They all may do it differently now with the pandemic, but in our county, we're in person, on phone, or virtual appointments. And other resources, the umbrella in the state for all the Highcaps who provide us technical support and fact sheets and trainings and resources is called California Health Advocates. So they have a list of Highcaps in the state if you need to contact one that's not Contra Costa, as well as other information. So here's their website. Social Security, of course, to enroll and determine if you're eligible for Medicare. Medicare itself for questions on coverage and claims. There's a really good nonprofit, the Medicare Rights Center, and they have an excellent, a lot of toolkits and information, including presentations on ESRD and so forth at MedicareInteractive.org. And same with National Council on Aging. They have a lot of different information helping you with your Medicare benefits. So we have about 15 minutes left. I'm going to stop my screen share and take questions. Deborah, if there's a lot that came in, we can do it that way, or people can just raise their hand and we can do it. I can't hear you. You're muted.
I'm muted, sorry. That was a wonderful presentation.
Thank you.
A lot of information, but you explained it so well. So thank you.
Great, you're welcome.
We did have a couple of questions come in. The first one is, if someone under 60 had a transplant nearly 20 years ago and didn't sign up for Medicare as they were covered by an employer plan and didn't think they could, maybe rules were different 20 years ago, can they obtain coverage for immunosuppressant medications through Medicare now? And didn't the immuno bill provide for coverage beyond 36 months after transplant?
If they have, so if it's 20 years ago and their transplant is successful, then to get Medicare coverage right now, they either have to be 65 and age into Medicare, or if they're on SSDI, Social Security Disability Insurance, for at least 24 months and have Medicare that way, then they can have Part D cover their immunosuppressants. But if they didn't have Part A and B 20 years ago when they had the transplant, they'll never have a chance to have Part B covered. It has to be Part D, and to have Part D, they have to have one of those other types of Medicare. But if they have no other insurance right now whatsoever, then that new Medicare Part B-ID for $97 a month, now they can get that to cover their transplant drugs, only if they have no other kind of coverage for those drugs. You may be working and your employer might not cover those drugs. Then you could get that, for instance.
Okay. That is just, yeah, so confusing.
I know.
Also, I meant to ask you this at the beginning. Is it possible to get a PDF of your presentation?
Yes, I was going to actually say, and I forgot, so thank you, that I will email you a PDF of it so you can send it to anyone who wants it.
And I will send it out, and also we'll post it on the website with the video too.
Right.
Do I need a prescription for in-home care after a kidney transplant, and for how long?
Generally, I don't know that I can answer it specifically related to transplants, but generally Medicare covers home health care. If the doctor certifies that you're homebound, that doesn't mean you can never leave your house, but generally you can't get out and about except for going to the doctor or church or something that they allow, and that you need services at least so many days a week for a certain period. So there's some rules around home health care in general, and that home health care has to be providing skilled services by a licensed RN or a physical or occupational therapist. And if it approves those services, they'll also cover aids to do, help you get dressed and that kind of thing. So that's just generally under Medicare. When it comes to transplant related things, I don't know if the rules are different or if it still has to be according to those general criteria or not. I've never had anyone ask me about that, and it's the bulk of what we deal with are people not with ESRD, so we're more familiar with the general rules than we are with the nuances of things like that. But your local Highcap, whoever asked that question, could certainly help research that for you and help you get an answer.
Okay, thanks. I turned 65 in September 2023. Insurance is with spouse who will work until June 30th, 2024, when he retires at age 66. If I have a transplant in the first half of 2024 or after September 2023, should I start Medicare and Gap policy before my husband retires or upon his retirement?
So wait, tell me the dates again.
The dates again. Turning 65 in September 2023. And the spouse is going to work until June 30th, 2024. And the transplant the first half of 2024 or after she turns 65.
And she's covered under the spouse's insurance, not her own
It
job?
Sounds like, yes.
All right, so I have to think about this, and I hate to just give an answer off the top of my head anyway, because it's complicated. So she's eligible for Medicare herself this September. And she'll be 65, so I forgot to mention the coordination, the 30-month coordination period. Even if you're over 65, and on work insurance, it still applies, I'm pretty sure. This is a question I can't answer off the top of my head. It requires a lot of thinking and
I
all of that. I'm going to say the
understand.
wrong thing. So whoever else is in that situation should contact your local HICAP program and set up a meeting with them and get help.
Sounds good. Okay, if I'm not in ESRD at 65, but will be shortly after, and spouse is still working and has employer insurance, should the similar question, should the kidney patient go on Medicare at 65, even if the spouse has employer insurance for another year?
Yeah, that's another question I don't want to
You have
answer
to
off
weigh
the
it
top
all
of
out,
my head.
right? Yeah.
Yeah.
We have a compliment. Thank you so much for all this information. Jackie lives in Atlanta, Georgia, but she can use some of the information even though she's not local.
Great.
Is the only way to apply through the SSA office? And can Highcap help submit an application to SSA for end-stage renal disease Medicare coverage?
No, because the dialysis center or the provider has certain forms that they have to submit verifying it, and we have no way to obtain that. And our role is not to, we aren't SSA experts, and SSA won't even talk to us about without the person being present. What we can help you with, we can help you look at the SSA application for Medicare and help you fill it out, but we can't do it for you. And we certainly don't have the stuff needed from the doctor or the dialysis center, which for ESRD Medicare is like the first step. But still talk to your
Fill out
HICAP.
the form.
Yeah. Still.
If someone is over 65 and has Medi-Cal, but has never worked in the US, can they get Medicare Part A for end-stage renal disease?
Well, if you're over 65, you're eligible for Medicare due to age, not ESRD and Medicare anymore. And if you've never worked and you don't have the 40 quarters to get free Part A, you have to buy Part A, and that is about $500 a month, which you can do. Or if you qualify for that one program, QMB, which was assets below in California, 130,000 if you're single, and income below like 1,200 something a month if you're single, then that'll buy your Part A for you and pay it for you. But otherwise, you have to pay $500 a month to get it.
Okay. Can Highcap help with the reinstatement of Part B?
Yeah, if you got terminated from Part B for failure to pay your premium or just whatever, definitely talk to your local HICAP, depending on the circumstances. And if you have an enrollment period, there's certain enrollment periods when you can get Part B, and when you're first eligible, or if you did not have ESRD and you were working, you could defer till you stop working. Otherwise, you have to wait till that general enrollment period. And that's January 1st to March 31st of each year. So you have about 3 more weeks to get it under that period this year. If not, you have to wait till next year. So you need to act quickly and talk to your HICAP right away. If there's a chance, you might need to enroll under that general enrollment period. And you may have lifetime late enrollment penalties for getting it late in the case of having to wait for the general enrollment period. So your HICAP can definitely help talk to you about all that, or see there's certain special rights where Medicare will grant you Part B, where SSA will, outside of that enrollment period if you have a good reason. So yes, your HICAP can definitely help you with all of that.
Do those penalties usually run?
The penalties for Part B are lifetime, and they're typically based on every 12-month period when you should have had Medicare but didn't. So if it was only 8 months, you won't have the penalty. You'll still have to wait to get enrolled in the general enrollment period, but you won't have the penalty. But for every full 12 months that you didn't have Part B and didn't have a good reason, then you pay a penalty for, and it's equal to 10% of that year's Part B premium. So if Part B is 165 a month right now, 10% is 16 a month times the number of 12-month periods that you were late. So if you were 5 years late, it would be 5 times 10%, so 50%, so another 80 something a month on top of the 165 for Part B for life.
So it can add up.
Yeah. Oh, absolutely.
Why is Medicare not available to those waiting for a transplant with a GFR under 15? Is it only if you're on dialysis?
I don't know why Congress created the rules for Medicare over 50 some years, and they had some carve out about ESRD that was part of some horse trading they did. I don't know, but so who knows? I can't answer why. All I can answer is the rules. And the rules, if you're waiting for, you have to be on dialysis. Oh, my slide just had the general rules. ESRD means dialysis or transplant, but they actually have specific criteria about GFR, this and that. But it has to be a diagnosis of either ESRD or a transplant. And if it's a transplant, and if you're not on dialysis and you need a transplant, we talked about on that slide when you're eligible, with the month you enter the hospital for the transplant or the transplant related services, if you're having a transplant no more than 2 months later. So that's all I can tell you about that.
My employer health plan will cover my dialysis treatment 100% past the 30-month coordination period. Do I have to get Medicare?
Yes, absolutely. You have to get Medicare, and you need to talk to your employer then about the cord, if they'll pay, because Medicare becomes the primary payer then under law, and they would pay 80%. So your employer, it sounds like, would then pick up the balance,
the 20%.
And pay the full balance, and you wouldn't pay anything, but Medicare would still first be billed and pay the first 80%. And that's when I said you might not even know that it switches over because you still just aren't getting any bills, so you don't care. But it does switch over, and Medicare would pay the first 80%, and your employer would pay everything else in that case.
Okay.
But you do need to get Medicare, or you're going to have problems
later. If you go on dialysis or get a transplant and lose your job, can you get Social Security?
So wait, say that again?
Yeah, if you go on dialysis or get a transplant and lose your job, can you get Social Security?
Well, that depends
on your age, right?
Your age and how many quarters you've contributed to Social Security and all of that. And unless you're disabled, SSDI disabled, to get Social Security, you have to meet the criteria to get Social Security disability, which is like considered a permanent disability, and get approved for that. Or you have to be at least 62 and have worked your 40 quarters and take your Social Security retirement early. And beyond that, I don't know if there's any other way to get Social Security. Yeah. That's not my.
If you're on dialysis, yes, you qualify for Medicare, but that wouldn't get you Social Security.
Right. That's a different thing. Yeah.
Right. If considered high income, do you have to pay for Part A Medicare?
No. Part A, if you are eligible for free, because you worked 40 quarters when you're getting retirement benefits, or that sliding scale if you're younger and have disability or ESRD, as long as Social Security says you're eligible, then you get it for free. Okay. If you're eligible for any kind of Social Security benefit, retirement, disability, whatever, you get Part A for free.
Okay. How can we apply for QMB as the person has no assets and a monthly income of $800?
Okay, then you're definitely eligible, and you apply through QMB and those Medicare savings programs are a combination of state and federal programs. And the limits I told you for assets and income are in California. Some states it might be a little different because it's a combo of money, but in all cases, it's administered by your state. The same departments that administer Medicaid. So here in California, it's through your county Medicaid, Medi-Cal office does the QMB applications.
Okay. That's all of our written questions.
And I want to just add to that, and your Highcap, at least through our Highcap, I don't know about others, will help you apply. And we have the applications for QMB and the link for the online one, and we can help you apply. Other Highcaps might not provide that service. They might just say go to your social services department or your county Medicaid department or whatever.
If any of our listeners want to raise your hand, I can unmute you if you have a question you want to ask. We've answered all of the written questions. And I'm just going to watch the panel to see if anybody raises their hand. This has been an excellent presentation. It's been so informative.
Good. I know it was a lot of information and we had to speed through it, and it's probably overwhelming, but at least hopefully now you all know where to go to get more information and help, and you're aware of some key pitfalls and time frames and things you have to consider and all of that.
Catherine, you have a question?
I do, thank you. Hi, my name is Kathy. I'm a social worker at a dialysis center, and I was actually the one who asked about submitting the applications, and just wondering if, do you know if Social Security is accepting fax? Our insurance coordinators used to be able to complete applications, and then we would fax them in, but I was told that Social Security is no longer accepting fax applications.
Yeah, I don't know myself if they are. I know here in our region, at least, you can go in person or you can do things online, which doesn't apply. That's just for the normal easy Medicare, not for what you need to provide for the ESRD Medicare. And I don't know, you might look at their website. Their website should say if they're still accepting fax. I don't know. Or you can call and ask them.
Okay, thank you.
And Phil?
He's muted. I see your mute symbols on, Phil.
No, I didn't have a question. I just hit that accidentally.
Oh, okay.
But thank you for your presentation. It was very, very important.
You're welcome.
Phil's president of the Bay Area Association.
And I hope our listeners got something out of this and it was valuable for them.
I hope so too.
Yes, thank you.
And Rebecca.
Can you hear me?
Yeah.
Yes.
Oh, sorry. Oh, great presentation. Thank you so much.
You're welcome.
I wish I would have had all this information before my transplant because I chose to stay on Obamacare or open coverage after my transplant for 6 months. And I think I would have saved a lot of money had I not chosen that path.
Yeah.
I'm on Advantage in Medicare. My question is, you get Medicare for 36 months with the Advantage program if you're under 65 after transplant. After that, you're not able to get obviously the Advantage care anymore because Medicare ends on the 36 months. Now, if you got, say your transplant June 15th, your Medicare, I think, starts June 1st. On a 36 month, does it end then June 30th? How does that work? I'm just wondering.
You would just count the 36 months. So if your Medicare started June 1st, you have to count 36 months, June, July, so forth, which I guess would probably take you till May 30th, 3 years later, but I haven't counted it out, but I think.
Yeah, I just found it confusing because like my transplant was June 20th.
So it's your Medicare eligibility date with the 36 months, I think.
Yeah.
Yeah.
I think you pay for the month, is that how? it
Yeah,
was?
yeah. Medicare never ends or starts mid-month. It's always the first or the last of the month. For
That's
start.
right. So it would end probably June 30th. They didn't have the answer for me when I had
Or
called them.
May 30th. I mean, if you look at the calendar, 12 months, let's just say 1 year, June, July, August, September, October, November, December, January, February, March, April, May. Yeah. So if it starts June 1, it ends May 30th of 3 years later.
Okay, good to know. Thank you very much.
That is
Welcome.
helpful. I think that's all of our questions.
All right. And can you give me a head count of how many people were here?
We have 27 people. That were,
Okay. Great.
so that's a good turnout.
Yeah. All right. Well, I will send you a PDF of my slides.
Okay, and this
Okay.
session has been recorded and it will be posted on our website. And I thank you again, Pam. You've been such an excellent speaker and it was such helpful information. You took a complicated subject and you broke it down so that at least I could help understand.
Great. Well, good. I'm glad. I had, you don't know, when I first started looking into this on behalf of some of our clients, I watched webinars from every Medicare organization out there about ESRD, and I watched them about 3 times, and I looked at all the written things. And then I distilled it myself into my own 4-page tip sheet for when I
You
got
did,
future
yeah.
questions. So
You've done a great job.
so anyway, all right. Thank you.
Thank you
for
so much.
All right, you're
All right.
welcome.
Goodbye,
Bye-bye.
everybody.
Okay.